Thank you so much for joining us for OSC's Community Lecture Series. My name is Chelsea and I'm part of our OSC marketing team. As you can see, I am live from my sunroom. So with COVID, we're just doing our best to socially distance. And we are in different places, in different cities, just trying to make the best of everything and come to you in your homes, wherever you may be, over your dinner table or in your living room with your family, just giving any information that we can to you during COVID in a safe manner so that you don't have to come to our office. This is something we would typically do monthly in our office. And right now we're doing everything we can to use technology to our advantage and just come to you in any way we can. Tonight, we will hear from our newest provider, Dr. Andrew Martin, who is a doctor of psychology, about improving your quality of life with chronic pain. I am going to share a presentation with you now. All right. Dr. Martin will be taking questions throughout the lecture this evening. Visual instructions are now on your screen about how to submit those questions. If you have anything you want to ask, just follow those instructions and you'll get that information over to us so that we can ask Dr. Martin. For your privacy, these questions are not public and you may choose to remain anonymous even when you submit your question. Either way, your name here tonight is not something that will go public to the users who are using Zoom tonight to also view this call. Before we begin, I'd like to tell you just a little bit about Dr. Martin. He started at OSC at the beginning of the year as part of our interventional pain management team. He utilizes cognitive behavioral therapy, mindfulness, and other mental health therapies to provide patients with practical tools to reduce chronic pain and improve functioning. He also specializes in trauma therapy, utilizing cognitive processing therapy and psychodynamic therapy to help reduce the emotional pain associated with traumatic experiences. He joins OSC having served 20 years as an active duty Navy clinical psychologist, where he specialized in psychotherapy for chronic pain, trauma, and anxiety. Please join me in welcoming Dr. Andrew Martin. Good evening, Dr. Martin.
Hi, thank you, Chelsea, for that great introduction. Thank you for setting this up. Hello, everybody, and welcome. Thank you for joining me. You can see here currently how to ask questions. Chelsea will watch the questions as they come up, and I'll do my best to answer them at a couple places during the session. If we don't get to your question during the presentation, we'll certainly prepare an answer and get it to you later. Okay. Okay, so what is chronic pain? Next slide. Oh, and before I get into this, so what we'll do is we'll talk a little bit about pain, chronic pain versus acute pain, talk about how it's handled medically a little bit, and then we'll jump into how a pain psychologist would intervene and help somebody with chronic pain. So here's a good scientific definition of pain, and you can see it's got the physical aspect, but a lot more than that. Got the emotional part, some of the trickiness of pain, whether there's actual or maybe there's going to be damage or an injury. And then you've got a very subjective ending there, described in terms of such damage. And those last three parts of the sentence show us how much more there is to pain than just the physical experience. I want to share something with you that's not on the slide. This is a description of chronic pain written by Dr. Murphy. She's one of a team at the VA that prepared one of the best protocols for the psychological treatment of chronic pain. And it really resonates with a lot of folks who have chronic pain. Think of yourself like a machine. All the gears work together to keep your body going. When you're not in pain, life tends to be easier. You feel good, and it's easier to get things done. When you have chronic pain, it's like having a bad gear that doesn't go away. It disrupts all the other gears and slows down the whole machine. Over time, it can bring the entire machine to a stop. When I share that with folks in therapy, it resonates really well with what people are experiencing. Another thing we talk about is, unless you've been through chronic pain, it's really hard to imagine what it's like. And even my patients will say that before they had chronic pain, they may have been a little judgmental of other people who said that they were having chronic pain. But then once you experience it yourself, you know there's a lot more to it than just the physical aspect and how much it affects your life. Next slide, please. Okay, so here's a good look at the basic nerve and pain process. It starts in the nerves, and we'll talk a little bit more specifically about that. The nervous system includes the brain, though. And so besides a physical reaction, this is going up to the part of our body that deals with thoughts and emotions. And as you'll see, there's a lot can be affected by pain, and there's a lot that can affect pain. Because pain is so much bigger than just the physical aspect, that's actually a good opportunity for us to take some control and mitigate how bad the pain is, and more importantly, how much it interferes with our function. Next slide. Okay, here are the different types of pain. Nociceptive, this is when a damage, injury, like a broken bone occurs, or maybe inflammation from something like arthritis. This acts on the pain receptor, causes pain. Neuropathic pain, this is when the nerves themselves are being damaged and then sending a pain signal. So a herniated disc, a disc in your back is pushing on and damaging the nerve there. That's neuropathic pain. And then finally, a little bit less understood is central sensitization pain. This is where pain signals come on randomly. This is pain that may not have an observable physical source or an injury or damage that the doctors can find, and yet it's just as real. A good example, well, the perfect example is phantom limb pain. So if you're hurting in a place that you don't even have, it tells you that there's something else involved besides the pain receptors in that place. Or fibromyalgia, kind of global pain, very difficult, and we're still learning a lot about that diagnosis. Okay, next slide. Okay, it often helps to think about the difference between acute and chronic pain. Basic difference is acute is 3 months or less, chronic pain is longer. Something else that's helpful to think about is that with acute pain, there's almost always damage. There's an injury, and we know its source. With chronic pain, the injury's done, it's healed, but the nervous system may be still perpetuating that pain somehow. The treatment is different as well. So with acute pain, it's mainly a medical treatment, and we're looking for the injury, we're treating symptoms, treating the cause of the damage or injury that's causing the pain. With chronic pain, the problem that we could find is cured or it's healed. Pain is persisting, and so psychological factors become a lot more important, and that's when a pain psychologist might get involved. Finally, and this illustrates part of how pain interacts with the rest of our psychology. Pain that is acute, that's from damage, that's a very useful signal, right? It's evolution's way of telling us something's wrong. Take your hand off that hot stove. Time to stop using that limb. It's time to heal. With the chronic pain, that's not such a useful signal because there may not be damage. You may not need to not use that limb anymore. But the normal thing is to react as if it's acute pain when maybe you don't have to. Next slide. Okay, and this just shows the course. This is another way of describing acute and chronic pain and their duration and what they look like. You can see over on the left, the height of that line is the intensity of the pain. So you have an injury, pain comes on, and then as the damage slowly heals or is treated, then the acute pain goes down. If pain persists, it's chronic pain after the healing has begun. And then that pain goes up and down. What is it varying with? What's causing it to go up and down? Lots of different factors, which we'll get into in a minute. Next slide. Okay. Advance one more. I think this is a two-part slide. Advance several more, please. 1, 2, 3, 4, 5, 6. Okay. All right. So this is a quick look at how many different areas of our lives are involved in pain. Up at the top, you've got the main one, sensory, physical, our physical experience of pain. Then you have all these other areas that are affected by pain, and then pain can be affected by them as well. So for example, under emotional, anxiety, it's normal to feel anxious and afraid when you experience pain. If the anxiety keeps going, then you may start paying more attention to the pain. And so you become sensitive to it because you're looking for it, because that's what we do when we feel anxiety. That's our way of protecting ourselves. It affects our social lives. We may isolate, may put strain on relationships. And when that happens, then that brings up some more emotions that can then affect our pain as well. We know that folks who are engaged in enjoyable activities and socializing with others are more resilient to pain and just feel better generally. And we'll get more into that later. And finally, cognitive. Pain will sometimes start some very extreme thoughts, like this pain is never going to leave. This is going to get worse and worse for me. Well, that's going to create more tension, more stress, more anxiety, which then makes us more vulnerable to more pain. Okay, next slide, please. And one more slide. Okay, so the point of this is to show that the brain has a lot to do with pain and how we're experiencing it. It can turn up a signal. It can turn down a signal. It can tell us just to ignore a signal completely. And in that work over time, the structure of nerves can actually change, making us more sensitized to pain or less. Next slide, please. Oh, okay. So, I wanted to mention Dr. Ludwig, Emily Ludwig, and give her, she was my predecessor, and I wanted to give her a thank you for most of this presentation is hers that she built up over the years working here before she left and left me with some really big shoes to fill. She was very, very respected. This is one of her favorite studies. So essentially, this study involved psychologists putting people through pain, very much like lots of psychological studies. But the folks were divided into 3 groups. Advance, I think, 3 slides. 3. Okay, that's good. So one group was given an analgesic or pain medication before being subjected to this heat pain. Now the heat pain, generally everybody was saying, oh, it's about 66 out of 100, 6 or 7 out of 10. The folks who were given a pain medication without realizing it, instead of 66 out of 100 pain, they said, oh, I'm feeling 55 out of 100 pain. So even though they didn't know it was there, the pain medication was working. Group 2, people were told they were getting a pain medication, but then they weren't actually given a pain medication. Their pain dropped all the way to 35. Way past where the folks were that were actually given a medication, but not given the expectation that they would have less pain or that they were given a pain medication. And then finally, group 3 was given pain medication. Then they were told the medication was going to be taken away, but it wasn't. They continued the medication. These folks' pain jumped back all the way up to 65. When if you look at group 1, maybe it only should have gone up to 55. So here's another expectation playing a role. Go one slide, there might be another something on there. Okay, yeah, expectations playing a role. Next slide, please. So hopefully some of y'all were saying, oh, that's the placebo effect. We've heard about that a lot. Placebo effect is kind of like in stories where somebody's given a magic amulet and told, oh, with this magic amulet, you'll have the power and the confidence to do X, Y, Z. And then they do. But it wasn't the magic amulet, of course, it was them. Placebo works a lot the same way. And placebo trials are what we do to look at the effectiveness of medication. So often in randomized controlled trials of medication, we'll give folks the medication, or we'll give them a placebo pill, which is just a sugar pill, and tell them that it's the right medication. Generally, what you want to see is you want to see the actual medication doing better than the placebo, and that doesn't always happen. Nocebo effect, that's just the opposite. So that's giving somebody the expectation that treatment's not going to work, or they're going to feel worse, or they won't be able to do something. And that has an effect as well. And then one of the most mind-boggling groups of studies I've ever read about the placebo effect involves giving people placebos, sugar pills, for a condition, telling them that they've been given a placebo pill, that there's nothing therapeutic about it. And then they still get better compared to people who don't take the placebo. Very interesting finding. And it tells you something about the role that hope and expectations can play in our wellness. My last commanding officer told me that hope is not a strategy. And I said, well, it works in Star Wars, and it also works in psychology. And then he deployed me. Next slide. Okay, so here are a couple of those areas that we were looking at before. What role do emotions play? We definitely feel pain more when we're depressed. We notice pain more when we're anxious or when we're afraid. And then we know that trauma, especially from childhood, makes us a little more apt to feel pain or to have central sensitization that we talked about before, like in fibromyalgia. Next slide. And then, of course, mental health plays a big role with pain. Depression, very common in folks with chronic pain. Chronic pain is depressing. And then depression can make chronic pain worse. We may have trouble having hope for our treatment, and so we have a reduced response to treatment where we'll experience more pain. And then when we're depressed, it may be harder to accept pain that maybe is going to be chronic, or difficulties in functioning that are just going to be there for the rest of our lives. Next slide. Okay, now we'll get into the treating of chronic pain. I think there was a, Chelsea, I think there was a question slide in there before. Is this the point where you want to look for any questions, or keep going for? We'll just keep going. Okay, all right. Okay, next slide. Okay, here's a rather busy slide. This is about the medical treatment of pain. So what you have here is 4 different patients on your left, and you have 4 different treatments coming out on the right. This tells us that pain management, treatment for chronic pain, is going to be very dependent on the person themselves. And therefore, a therapeutic alliance is really important. It's very important with chronic pain for you to speak with your doctor and keep that dialogue going. That relationship should feel like a partnership where you are trying the interventions that you want to try, that you all both decide to try together, and there's a lot of feedback about the effectiveness of those interventions. This is an important place to keep hope as well, because different treatments work with different people. It's also good when you're getting medical treatment for chronic pain to make sure your team is speaking with each other. So if you have a physical therapist and a physiatrist and you have a pain psychologist, outcomes are a lot better when those folks are talking with each other. And it helps a lot when they're under one roof. Okay, next slide. Oh, here it is. I think you're muted. Here you go.
Here we go. I lost control of my mute button. All right. If you have any questions, please be sure to go ahead and put them in the Q&A. This is again how you might do that. The first part of the lecture did have just a couple of questions. And the first question is, how long would somebody typically go to therapy? Is it a session, a handful of sessions, the rest of my life? What does that look like?
Great question, thank you. So therapy that is chronic pain oriented can last anywhere from about 4 sessions to 12 sessions. And it just depends on how well the interventions and the skills being taught match up with your needs, and somewhat on the amount of pain and the different medical conditions that you're experiencing. The point of therapy is always to not need a therapist anymore. So there's always an end in sight with this type of intervention. And in fact, we start talking about that right from the beginning. We find out, how will you know when therapy's been successful? What do you want to see change? And what do we need to focus on together so that we're not in therapy forever? Sessions typically last an hour and happen once a week or so. So 4 weeks to 12 weeks, depending.
Okay, cool. And are we offering telehealth services with you, or do I have to come in person? What options are available?
I don't think that we have telehealth for my services right now. What we're doing right now is masking up and sitting 6 feet apart in my office. Most people seem okay with that so far, but we can ask about that if folks really would prefer telehealth. It's definitely possible, and telehealth can be as good as in-person psychotherapy as long as the technology is working and is working well.
Perfect. We're going to go ahead and keep going in the presentation for this evening, but if you do have more questions, just be sure to type it in that Q&A box down there at the bottom, and we'll let Dr. Martin keep going.
All right. Thank you, Chelsea. Okay, so what can I do? As we talk about the interventions, let's do a little reminder here of what makes pain worse and what makes it better. Obviously, mental health, emotions, negative thoughts, social withdrawal, these are all detractors from feeling better. Things that help, engaging in enjoyable activities, relaxation, special type of relaxation that we'll get into in a moment here, and feeling well, or having some distraction. Next slide. Okay, so every protocol for psychological treatment of chronic pain includes these tools. So how to plan pleasant activities, pacing ourselves, special relaxation techniques, mindfulness, which you've heard in the news a lot lately, and then of course taking care of mental health symptoms so those don't interfere or complicate with our pain. Next slide. Okay, planning pleasant activities. Well, why is that important? First, it's important because it goes away when we have chronic pain frequently. It goes away with global pandemics as well. And a lot of us have realized and figured out how important that is. Maybe we haven't put it together yet, but you can see that a lot of people's unhappiness and depression that's come about with the pandemic is that from that reduction in doing things that are pleasant. Pleasant activities produce endorphins, a natural anti-pain chemical. It helps us connect with our values and feel more in control. And it gives us a timeout. I'll talk a little bit later about how pain, anxiety can be kind of like a runaway train that just is going downhill and going faster and faster. And it just takes a little bit of distraction to stop that process and slow down the train for a long time. And then it gets us in the habit of taking care of ourselves, being compassionate towards ourselves by practicing doing pleasant activities, not as a reward for doing something else, but just because it's important. Next slide. And here's a log for pleasant activities. The log is the psychologist's solution to every behavior change. Is you write it down, you plan it out, you measure how well it worked, and then you take some notes and then try again the next week. So why do we write things down in a log? Well, I think you'll agree that goals like, well, I'm going to lose weight, or I'm going to do something nice for myself, those are kind of hard to get going. But if we get a little more conscious about it, write down exactly what we're going to do, and then remind ourselves how well it worked or not, that brings the process up into our conscious awareness a little bit better, helps us commit to the behavior change. Okay, next slide. Pacing. All right, this is one of my favorite tools. Pacing is designed so that we can do more of what we want to, or in the case of mowing the yard, more of what we have to do without hurting ourselves, and being able to do more the next few days. So if you normally thought about task completion as I start the task and then I do it till it's done, and that's how I do it no matter what happens, that can end in a lot of problems when you have chronic pain. So you may get the lawn mowed in an hour, but then you're broken the next 2 days and can't do anything. Pacing for something like that would look like this. I mow for 15 minutes and I take a break for 10 minutes. Mow for 15, take a break. It takes me longer to get the thing done, but I'm able to do other stuff the next 2 days. Next slide. And here's the log sheet. So when you work with a therapist, or you can do this on your own as well, you figure out your activity and rest times based on when you experience the most pain. So if walking for 20 minutes, you can do that without significant pain, but any more is going to give you a lot of pain, then you back down by that just a little bit. So when you walk, you do it for 16 minutes, 18 minutes. Then you rest for a while. So the trick is to figure out where your breaking point is and stop just before that, before there's any injury. And then take a break, then go back to the activity. And we kind of went through what that looks like with an example before. Okay, next slide, please. All right, another good one. So there's relaxation, and then there's relaxation. The mental health relaxation has to do with deep physiological relaxation using some special techniques. A lot of us think of relaxation as well. If I'm sitting in front of the TV and enjoying myself, that's relaxation. But if you're experiencing chronic pain or anxiety, even though you're sitting there relaxing, enjoying a program or a TV show, you may still be stressed. You may not even realize it. So relaxing the nervous system involves techniques like deep breathing, and we'll show you what that's like in a moment. Visualization or guided imagery, which is a type of mindfulness. Progressive muscle relaxation, which is kind of like a self-massage that you can eventually do with your mind, and relax various muscle groups just by thinking about it. And then, of course, other complementary alternative approaches like aromatherapy, yoga, relaxing music, all shown in research to physiologically relax us. Okay, next slide. Okay, so deep belly breathing. This is relaxing breathing. You all have probably seen a pitcher in a Major League Baseball game do something like this right before he pitches or gets ready. You may even see that in some other sports figures. Well, they get that from sports psychologists. And what's going on there is it's a really fast way to decrease anxiety. anxiety, say, because you're on national TV in front of millions and you've got 40,000 people there in the stands and they're all watching you about to win or lose the game. A little bit of stress, a little bit of anxiety. But it's amazing how much can happen with one breath that's done the right way. So this diagram shows how we take our very first breath when we're born before we know any better to breathe in an anxious way. It's also how we breathe when we're asleep. And if you can think about hearing somebody next to you while you're asleep breathing, you know that type of rhythm, that sound. So a relaxing breath pushes our belly out. We push our diaphragm, and then air is going into the deepest part of our lungs. And then when we exhale, belly comes in, air comes out. That's a lot different from anxious breathing, right? So when we're anxious and tense, we're breathing up here from our chest. And while that may be good if we're in a life and death situation, it's not helpful for reducing anxiety. And so we train folks to stop that type of breathing and make it more deep, and you can actually trick your nervous system into believing that you are in fact relaxed. And then, as you can see, there's a lot of other benefits. Okay, yeah, next slide. Mindfulness. You've heard a lot about it in the news the last few years. It's actually 10,000 years old. Western medicine is just now getting around to opening the door to mindfulness. So far, all the studies are very promising what this inexpensive intervention people can do on their own can do for a host of issues. So in the cartoon here, you've got, is your mind full? And this person's worrying about everything that's going on around them while they're walking in the park. The person on the right is focused on walking in the park, and their stress levels are going to be very different. So mindfulness is just a way for us to take some control of our thoughts and thereby influence our stress level. This works a lot like other forms of distraction where you're slowing down that speeding train. Just takes a little while, a little bit of mindfulness to reset that and get back to a more comfortable pace. Next slide. Okay. The other thing mindfulness does is help you increase psychological flexibility. They say we get more stubborn as we get older and can't think as flexibly anymore. This can help. And we'll do a little demonstration later about that. None of us can control our thoughts completely. For instance, right now, don't think about a giant pink elephant. Right? But we can learn to notice when we're distracted by something, by pain, by our thoughts, and then practice bringing our attention back to something relaxing. And that helps us become more flexible. One of the best mindfulness exercises is imagining a place that's very special to you and calming, and then slowly walking through that and imagining what it's like for all of your senses. It can become a very rich experience that's very helpful for relaxing folks. Okay, next slide, please. Okay. All right, so for those of you who would like to, I'm going to do a very basic breath meditation exercise. It's a little bit of mindfulness and a little bit of breathing in the proper way. Let's see, I need to get my slides up here I want to use. Thank you. Okay, you can go back to the main one. Okay. So sit comfortably in the chair. Make sure you're comfortable. And if it's safe to and you're comfortable, go ahead and close your eyes. And first, start by becoming aware of your breathing. Without trying to change anything, Simply notice how you're breathing. Notice where you are breathing from, whether your shoulders are rising or falling, whether your chest is rising or falling, or perhaps your belly is rising and falling. Now notice the rate of your breathing. Are you breathing rapidly or slowly? Are you breathing deeply or more shallow? Now, as you slowly inhale, imagine the air flowing deeper into your belly. Feel your belly fill with air as you take in a breath. When you exhale, follow your breath out as you completely exhale. Slowly take a breath in, 2, 3, 4, and slowly exhale, 2, 3, 4. Let any tension melt away as you relax more deeply with each breath. Notice how the air feels as cool, fresh air enters your nose, passes through the little hairs in your nasal passage, reaches the back of your throat, and descends deep into your lungs. Notice what happens as that breath of fresh air enters your lungs. Notice what happens when you exhale. Feel the temperature of each breath. Cool as you inhale and warm as you exhale. As you are distracted by your thoughts or sounds around you, I want you to notice that distraction, let it go, and then return your focus to your breathing and the air flowing into and out of your nose. Notice your breath becoming smooth and slow. Feel your belly expand outward with each breath, and feel yourself become more relaxed with each exhale. Allow your shoulders to become heavier with each exhale. Continue breathing slowly and gently. It's nice to know that if you become distracted by your own thoughts or by sounds around you, you can simply notice that distraction and then bring your thoughts back to the air flowing into and out of your nose. Feel yourself become more and more relaxed with each exhale. Now, as I count from 5 to 1, feel yourself become more alert. 5, bringing your attention to the room you're in. 4, feeling calm and relaxed. 3, wiggle your fingers and toes a little bit. 2, slowly start to move and stretch a few muscles. And 1, open your eyes, feeling refreshed and rejuvenated. It can be quite surprising, even a little simple exercise like that, how much it can relax us and how much more calm, resilient to stress, less sensitive to pain we can become. And you may not even notice how stressed you are until you do an exercise like this. I'll share a personal story real quick. My first experience with this was on psychology internship at the Naval Medical Center in San Diego. I was on rotation and my teacher and I were running a group for chronic pain, in fact. and he did this exercise, but I mean, he'd been doing it for 40 years. And I'll tell you, I floated out of that room after this exercise. It was so relaxing. And it's just amazing what that can do. And then you can learn to do it on your own. In fact, next slide, please. Those of you who like apps, there are apps that you can use that will walk you through an exercise similar to that, or a different kind of mindfulness exercise. Sometimes it's helpful to begin it with a coach in person, but the goal of therapy absolutely is to turn the skill completely over to the patient so they can do this on their own. Okay, next slide, please. Okay, and then finally, addressing mental health symptoms. How our thoughts and feelings operate can significantly impact our pain, how we experience pain. Cognitive behavioral therapy is based on the idea that our thoughts can strongly influence our mood and our behavior in ways that can be maladaptive. And it's not just the thoughts that we're aware of, but thoughts that are so ingrained and we're so used to having for so long that we don't even notice them. They're subconscious or unconscious. Cognitive behavioral therapy helps us start to see those thoughts that may be troubling or keeping us stuck, making it difficult for us to accept something, making it difficult for us to change a behavior, or causing us anxiety or depression over and over. Acceptance and commitment therapy, that's basically the serenity prayer turned into a psychotherapy protocol. So it's about accepting the things that we can't change, like a reduced functioning or a chronic pain or a medical symptom that's probably not going to go away, or having to take a medication or wear something special for the rest of our lives. And then commitment is the realizing what we can change to improve our pain or our functioning, and committing ourselves to making those changes. Behavioral activation, commonly used with depression, is about getting more active and then using that activity to boost the mood. So enjoyable activities, exercise as safe as your physician says it is for you. Problem-solving therapy, just like it says, working together on problems, sometimes talking about our thoughts and behaviors, but having a neutral third party there who will give you honest feedback and be a sounding board as you all work to solve problems together. And then finally, cognitive processing therapy. This one is associated with trauma, not as much with chronic pain. Cognitive processing therapy involves coming to terms with a traumatic event like combat or physical abuse or sexual abuse or assault or a really impactful loss in our lives. Cognitive processing therapy starts with a little bit of talk about the event itself, just to make sure that we've experienced all the feelings that came along and we get them up and get them done with once and for all. And then it focuses on how traumatic events affect our thinking. The theory is that a traumatic event will strongly affect our thinking, and we'll get stuck in that type of thinking, which may be helpful during an emergency or a horrible event, but isn't so helpful later on when we're trying to relax and live our lives. So processing therapy looks closely at those thoughts, helps us learn and see how our thoughts may have been changed, how that's been influencing our emotions and mood, and how that's been influencing our behavior. And they look at several themes, common themes like trust, self-efficacy, how we approach relationships, our sense of safety, and other commonly affected themes. And then a therapist can also be a help to get to a prescribing provider if that's something that you want to do. Okay, next slide. That might be it for me. And now any other questions that might come up?
That is. I'm still thinking about pink elephants. I don't know about all of you at home, but he told me not to. And so I have been thinking about pink elephants the rest of the time. This is just a notice that this is the last opportunity to ask your questions. So if you have anything else you'd like to ask, go ahead and put that in the Q&A box on your screen. Type that in, and just a reminder, everything will be anonymous. We're not saying your name. Nobody will see your name. It's all about just getting your questions answered. We have a couple of questions that have come in from home. The first one is, what do you do when it seems like nothing is helping your pain? Over-the-counter medications, prescriptions, physical therapy, surgery. Talking to doctors, it seems they don't understand or think that you're losing it because they don't see a problem, or they believe they've already fixed the problem.
Mhm. Great question. So it depends a little bit on your personal situation, but one of two things or both. Either it's time to work on accepting that there are limitations to your treatment and some things may not get better, or getting some help seeing what you might be able to do yourself. So acceptance or commitment, or a little bit of both, and talking with somebody who can be an advocate for you with your doctors, make sure they're hearing you and listening to you, helping you with how you talk to your doctors, and then doing whatever you can do of all those things that we mentioned today in the lecture, to take some control over what parts of your pain that you can. But yeah, that can be very frustrating, and that's experienced by a lot of people, that feeling that they're not listening to me. They should be able to fix my pain. They should be able to help me, and it's not happening.
The next question we have is, I sustained a serious spinal cord injury about 5.5 years ago. I'm currently seeing a personal trainer twice a week, and I've recently had updated MRIs and CT scans that indicated spinal stenosis. And then I had an epidural, which yielded no results. What behavioral remedies might you recommend?
Okay. Again, I have to interview and understand you a little better for that. And right now, the research doesn't really point us towards a certain intervention for a certain type of pain. I hope one day we get there. But it's psychology itself is kind of young as a science, and pain psychology is even younger. What we have right now is we see some improvement for all different types of pain and chronic pain. So I would probably wind up recommending trying several of those tools that we talked about in the lecture. But I don't have an answer for which one specific, because we just don't have the research results yet to match a certain one up with a certain injury. I'm not sure we necessarily ever will, because all of us we're such individuals, and there's so much that goes into what will work for us, might work for another person. And therapy is really about finding that out for you, what's going to work for you best based on your goals and what you want to see happen, not just let's treat your symptoms and your diagnosis.
A great answer. And I think, like you said, it's so complicated to figure out without seeing somebody what might be best for them. So it's kind of hard to do that via a Zoom meeting, like a webinar tonight. But with that generic model that could work for people, to go ahead and find those little things that work for them. And that's the big thing. And you detailed some really great stuff tonight. We're so glad to have heard that at home. We have just a couple of more questions. Do you only treat pain? Do you treat other things other than just chronic pain?
Absolutely. The chronic pain business is not going to take up a full schedule for me, which is nice, because it's good to have a variety of work. And I spent a lot of time in the Navy treating depression, anxiety, and when I worked with the Marine Corps, of course, treating post-traumatic stress, and really enjoy that type of work. So I do those treatments as well, and do psychological testing for cognitive decline, screening for dementia, personality testing, projective testing. But it can definitely help with things like general depression, anxiety, and especially trauma.
Yeah, and as you mentioned, sometimes some of those things come along with chronic pain. So even if you feel like your chronic pain's being managed, and There are other things that come along with that that are very important to seek help for, at least to get yourself those tools, like we mentioned, the toolkit you mentioned earlier, just to get you going. It's really important. I think the last question, unless you have anything else come up, is what is it like to be in psychotherapy? And, I think you use that term psychotherapy. It's something that's a little bit tougher to swallow, to understand. What is that exactly? What do you mean by that? And what is it like to be in psychotherapy?
Yeah. Psychotherapy is a collaborative relationship between you and the professional that is focused on your goals. People are mainly surprised with what it's like to talk to somebody who's not going to judge you, isn't going to criticize you, and can focus all of their attention on your well-being. It's a very unusual but very pleasing type of interaction. And most people are surprised by that. Sometimes they think they're going to get, diagnosed with something or thrown on medication or have to do some sort of treatment, or be told that there's something really, really wrong with them, when overwhelmingly the folks who go for help with therapy don't have serious mental illness, depression, anxiety, trauma, all low level, not to take away from anybody's suffering associated with those diagnoses, but on the severity scale, easily treatable. And people like that relationship. Some people are surprised that it's not just a venting session or what did happen to you this week, or that they don't have to just talk over and over about painful things. They like that instead the focus is first controlled by them. They decide what we're going to focus on and talk about in the session. But it's very problem solving oriented. And it's meant for you to become your own therapist, to build the skills you need. It's not meant to make you dependent on a therapist, but help you depend more on yourself by building skills.
That's great. And we had one final question. While you answer that one, I'm going to pull up on the screen this slideshow again, just to share with you some information. If you have any questions and want more information, you can reach out to us in a couple of different ways. The first one here is our phone number and then our email address. And lastly, if you have a smartphone and you want to go to our website, the easiest way to do that right now is to take your smartphone, open your camera app, and then focus it right here on this QR code in the bottom right side of your screen. You can pull up a website. That way you can just see more about Dr. Martin. That way you can see more about OSC, ask those questions if you have any more in the future. You're also able to make appointments there or give us a call, of course, and we can help you through that, guide you through making an appointment and answering any more questions you might have. Dr. Martin, the last question of the evening, what type of doctors are in-house at OSC? Who else do we have here? We mentioned there are other doctors that you often work together with. And so what type do you work together with at OSC?
Orthopedic surgeons, some specializing in different parts of the bone structure. Physical therapists. It's great to have a physical therapy team in-house. And then I work most closely with Dr. Sureja and Dr. Andrus, who are my colleagues on the pain intervention team and management team, and they are physiatrists. And if you're like me and you're wondering, what is a physiatrist? Physiatry is about helping people recover from an injury. So they may be treating some symptoms, but their focus really is on helping somebody get back as much function as they can. And that's a really useful intervention. As you can imagine, they work a lot with chronic pain, and they would work a lot with traumatic brain injury.
That's great. I just want to thank everyone at home for your questions. They have been fantastic. I have found this evening's lecture very informative, and I hope that you have as well. I have loved hearing from Dr. Martin. It's been great to get to know him over the last couple of weeks and to understand how he approaches His patience is just fantastic to hear. If you would like to know more about Dr. Martin, just some information to see articles that he's writing, to learn more about his approach, please visit our website at osc-ortho.com. You can call our office at 757-596-1900. And for the next couple of seconds, you can still take, just hover your smartphone's camera over that QR code. Thank you all very much. I hope you have a wonderful evening. Stop thinking about pink elephants and go do some breathing techniques. Thank you. Everyone have a great night.
Thank you, everybody. Hopefully next time we do this, we'll get to do it in person. Have a good night.